Good evening, everyone. This is Nitish from Medusane. And today, as far as in the career guidance series, we have Dr. Sakti sir, who is the ENT specialist. And sir will be leading us throughout this session with us, and he'll clear our doubts regarding how to choose ENT as in specialty. So here are a few crisp questions we have regarding choosing the ENT, sir. So we'll start with you. So what inspired you to choose ENT and what keeps you passionate about this field?
See, first of all, ENT is an surgical specialty. See, my interest was I wanted to be a surgeon. So, and in particular, ENT is an end specialty, meaning you don't have to do a proper super specialization. So it doesn't, if you choose general surgery, nowadays it implies if you want to live in tier one cities like Chennai or Coimbatore or Salem, you have to do a super specialization. You can practice as a general surgeon in tier two, tier three cities, no problems with that. But in if you want to live in a city, you have to do super specialization. But ENT, it is more like an end specialty, meaning that if you complete the degree, you're good to go into practice and you can pursue your career straight away. So that was the main idea with which I took ENT as a specialty.
Yes, sir. And how does ENT offer a mix of medical and surgical management, and what variety can resident expect? Because when people come into the ENT, they have the dilemma whether to go into they have to practice medical side or the surgical side, sir.
Right. See, ENT, there is no doubt it is a surgical specialty. But why this confusion whether to choose the medical side or the surgical side is ENT, because we deal with the upper airway issues, most of the conditions require medical management. So your practice is more of a mixture of medical practice and surgical practice as well. So, but then it's not like if you're an ENT, you are a surgeon, there's no doubt. But you can choose like if you want to focus more on surgical part, or if you want to be nowadays ENT itself has a lot of subspecialties. There are people who focus only on otology, some people focus only on rhinology. I, for one, I focus more on obstructive sleep apnea and snoring. So nowadays, a lot of though I said ENT is an end specialty, it has its own subspecialties, meaning you don't have super specialty degrees, like you don't have an MCH degree for otology. But then, if you want to focus on that particular field of ENT, you can get yourself trained and equipped by visiting various centers in our country and as well as internationally, and get yourself trained in that particular field, and you can focus more on that. And there are people who are happy with practicing general ENT. It is a mixture of both medicine and surgery. And there are people who practice like vestibular thing. They focus mostly about this giddiness and the vestibular workup and other treatments. There are people who call themselves neurotologists. They're all like there's no a proper super specialty degree, but then you can train yourself and you can focus on that particular subspecialty if you wanted so.
Okay, sir. And what key procedures and skills should ENT surgeon, the residents master, and how are they acquired, sir?
See, like any other medical field, the clinical skills are the most important thing that you should acquire when you are doing a post graduation. You should see a lot of cases. You should learn to diagnose conditions, because only the most important thing in any medical specialty is that you should be able to make a proper diagnosis. If you make a proper diagnosis in due course of time, you will know what to do about it. And of course, you will have enough exposure with the surgical part in your post graduation also. And like I mentioned, if you choose to focus on any particular field, or even if you want to focus more on the surgical part, post your graduation, that is even after finishing your MS ENT, you can visit a lot of centers observe and be their fellow. A lot of centers offer fellowship and observerships. You can visit there and get yourself in more advanced surgical skills.
And sir, we have a very typical question, which is the how is the work-life balance after taking ENT, sir?
It's in fact, if you ask me, it is one of the best field for work-life balance because it's though of course you have emergencies, but it's not like every day you're going to have emergencies, and it's a field where you can practice at your pace. It is not like a very stressful. I would not call it very stressful field. You can choose, like there are people who are happy practicing the medical part of ENT, and there are people practicing only the surgical part of ENT. Both of them are happy from a work-life balance part. So it's like it's one of the better field in terms of work-life balance.
And sir, what research opportunities exist in ENT and how residents contribute to the field, sir? Because some after finishing the MBBS, they don't want to keep doing the clinical studies. They want to contribute towards the research. So how would you guide them, sir?
Like any other medical field, there is ample scope for research. Like I said, ENT is like in the past 15, 20 years, it's really transformed from the original only tonsillectomy and septoplasty. If you go back 15, 20 years back, the only surgeries that ENT surgeons were doing were only tonsillectomy and septoplasty. Nowadays, ENT surgeons are entering into the domain of neurosurgeon because we are doing transnasal endoscopic surgeries. These are all cutting edge recent developments in the medical field. We are doing orbital surgeries, OSA surgeries for that matter. They are all completely transforming. It is a rapidly evolving specialty because there have been new equipments and endoscopes which have allowed us to see things from a different perspective. So, rapidly, you can even call ENT a rapidly transforming specialty. So, whenever there is a specialty which is seeing a lot of changes and transformation, it is also uh, implied that there is ample amount of research possibilities in the field.
Thank you, sir. And what is the the most challenging and rewarding aspects of ENT practice from your point of view or from your fellow ENT surgeons' point of view, sir?
There are two things. Like I said ENT is not a field where you will have emergencies every days. But when you have an emergencies, and if you have properly trained yourself to handle those emergencies, like for example, a patient comes to you with a stridor, and you are able to immediately do a tracheostomy and save the patient, that is a very rewarding experience from a very personal level. And there are patients who come with hearing loss. For example, you must have heard about otosclerosis. Otosclerosis patients, when you operate, right on the table itself, the patient can appreciate the hearing improvement. So, what better personal satisfaction can you get? It's simply like magic. So, a person is on the OT table, unable to hear, and you are doing a surgery, and right at the table, the patient says that he is able to hear and he is very comfortable and happy. That's something that you will not get every day in your practice. And this specialty offers these kind of gratification from a personal satisfaction level also.
And yes, sir. And how do the ENT specialists build a long-term relationship with their patients? The doctor-patient rapport, how is present in the ENT, sir?
See, doctor patient relationship is not specific or concerned only with ENT. Any specialty, it is about having a good relationship with a patient because it's all about seeing the patient as a whole and having a good relationship because we should not try to be kind of don't try to treat the disease, try to treat the patient. That applies to all specialities, and it is ENT is no exceptions to that. So you should have a good working relationship. Try to be honest. You put forth the facts, and in ENT it is more of an elective because it's not an emergency. Like In orthopedics, if there is a fracture, it has to be fixed. There is no alternative, or it is an emergency. But ENT, most of the conditions will be elective. So your duty is to put for the facts. What is the reason for the problem, and what can be done to make it better? What is the alternatives? And you have to explain, like, what is the time limit within which you have to get it treated. So if you have been, my personal experience is that if you just offer all the facts and let the patient make his own decision, that itself is a good starting point of having a good rapport with your patients. And that applies to all specialties, not just ENT.
That was like a valuable point, sir. And what advancements and emerging trends that you have seen in the field of ENT, sir?
See, there is a lot. Like I was telling earlier, ENT has undergone a rapid transformation thanks to all innovations that have happened in terms of this endoscopes, robotic surgeries, transnasal skull base, and transnasal intracranial surgeries. People are doing transnasal endoscopic fourth ventricle tumor removal surgeries. So most of them are, yeah, of course, they work as a team. Once you cross the dura, you're supposed to work with a neurosurgeon, but then it is a team in which the ENT surgeon is a very crucial member. So they've also taken up doing intracranial lesions also through the nostrils. That is one area where a lot of changes have happened. And of course, orbital surgeries are also happening. And even from the obstructive sleep apnea surgery, even just very recently, before 10 years before also, it is used to be only, if you ask OSA, it is only UPPP. But nowadays, so much has happened. A lot of diagnostic tools have come up, so that we are going more towards tailor-made and precision treatment for obstructive sleep apnea. So like that, every domain of ENT, because of the technology-driven transformation that is happening, there's a lot of new things coming up every day.
Okay, sir. And we'll come to the topic of the salary as well as the abroad options, sir. Because people who want to pursue their life, who wants to get settled abroad, sir. So how is the options for them, and what's the salary abroad compared to India as well as in the compared to other states of India, sir?
See, you have to consider it from abroad is a very broad area nowadays. So you have to think, if you're thinking about traveling to US or UK, it makes more sense to kind of travel to US or UK after you finish your MBBS undergraduation, because your post graduation degree is not recognized. It is only taken as an experience in US and UK. So it is not taken as a valid degree. That applies to all the post graduation degrees that is offered in India. But if you are traveling to places like Middle Eastern countries, where our degrees are recognized, there you can probably apply for a licensing exam, and then you can work in those department. In fact, a lot of people I know work in the Middle East, and there definitely, compared to India, the salary package is better. And I've known people who are very comfortable and happy working in the Middle Eastern countries.
Thank you, sir. And what's the final take-home message for the students, the NEET aspirants who are watching this video, sir?
See, any specialty, there is nothing called as this is a good specialty, that is a bad specialty. It is all about your personal interest. Okay. So you cannot, like, just because a specialty is considered lucrative, if you don't have a real interest in that specialty, it's not going to really matter. If you see, it is like you try to be the best in whatever specialty that you choose. It doesn't make sense to be an average person in a super specialty. Okay. So it is like what you are, whatever field you choose, there is always one person who is known to be legendary in that particular field. There you take whatever specialty, you take medicine, there is somebody who is respected and adored by everybody. You take general surgery, there is always somebody better. And there is a whole lot of people who are just average people. Don't try to be an average person in a good specialty. Try to be the best person in whatever specialty that you choose. And that really depends upon how interested you are and how passionate you are about that particular field. So if you have taken a specialty without much interest, definitely you are more likely to be an average person. But if you have taken some specialty with a good interest, or even, nowadays the field has become very competitive. Even if you don't get the specialty that you would have wanted, I would always suggest that have options. If you have something which you really want to become, but also have plan B, plan C. So even if you don't get your primary interest, you can go with the plan B, plan C. But the idea is you should develop a passion into the selected field. So it's like, it's not everybody marries after knowing the person before marriage. There are people, most of the people get married without knowing the person, but they make a good couple. So that is another idea that you should look. Whatever field you choose or you get, you develop an interest and passion. When the interest and passion is there, obviously you're going to be somebody special in that field, and that is the most important thing if you ask me.
Thank you, sir. And we have a question, sir, that what's the tip for college selection, sir? Because the people who are going to go for the counseling in Tamil Nadu Medical Counseling, so how would they choose the college, and how can people choose between the tier one cities or tier two cities? Where do they want to get posted, and how to select the colleges, sir?
Obviously, it depends upon, like, you consider how big a department it is. You can look out for like how many outpatients they deal with, how many units are there, and what is the because this is a surgical field, look out for, do they have daily theater days, or do they have 1 or 2 days per week? See, generally, if you have a big department which sees a lot of patient input and which has a daily theater day with probably maybe not too many units, like you should have at least 2 theater days per week. For, you might be posted in 1 unit. So ideal thing would be, if you are in a medical college which has 2 admission days per week and 2 theater days per week, that would be the ideal place. If the hospital and college has good patient inflow, that is the kind of place. Because when you're going for post graduation, the more number of patients that you see, both from an outpatient perspective and as well as the more number of surgeries that you see, the more experienced you are going to be. So that kind of colleges should be better.
Thank you, sir. And this was such a good and crisp session for us, sir. And people who are watching this will get benefited from this. And thank you for spending your time amidst your busy schedules, sir. Thank you so much for attending this
Thank you,
session.
thank you, thank you, man. Thank you. And if anyone is planning to take ENT, I think you can contact me through Medusane. I would be more than happy to guide you with how to choose and other things. And if you have any other doubt also, I'll be happy to clarify. You can get in touch with me through Medusane. Thank you. Thank you for the opportunity, man.
Thank you so much.